Artificial pancreas, the future of type 1 diabetes. The idea of creating an artificial pancreas is aimed at providing people with diabetes with greater independence and freedom in their day-to-day. Artificial intelligence in the pancreas. Diabetes is a chronic pathology that appears when the pancreas does not synthesize the amount of insulin needed or is not of sufficient quality or does not produce it directly, to absorb glucose, which is the main source of energy for our body. To date, the only treatment for people with diabetes who are insulin dependent, regardless of diet control and physical exercise, is that intended to obtain insulin externally through injections or an insulin pump. For this reason, one of the main objectives of diabetes research has been based on the idea of creating an artificial pancreas, capable of supplying insulin to the body autonomously and according to the needs of each moment. Something similar to what the insulin pump does, but without the need to inject at specific times manually. What is the artificial pancreas? In the same way that an airplane is not a bird, but it is designed to fly, the artificial pancreas is not a pancreas, nor does it look like it, but it is designed to automatically administer insulin that the pancreas does not secrete in patients with diabetes type 1. Its mission is to monitor plasma glucose continuously, deciding at all times the best insulin dosage for it. And if we want to control, what do we need? First, be able to measure what we want to control, glucose. This is done by continuous glucose monitors, which measure, or rather, estimate, glucose every 5 minutes. The second, being able to act to change what we want to control, that is, administer insulin. This is done by insulin pumps, whose dose can be adjusted continuously according to needs. This will be done every 5 minutes, with each new glucose measurement. The third and last, the magic formula to calculate the appropriate insulin dose based on the measured glucose and the target glucose to keep the glucose under control. This is what is known as the control algorithm and is the orchestra director of the artificial pancreas. Your physical form, a computer program housed in the insulin pump itself or in a mobile device. We already have all the ingredients of an artificial pancreas. Artificial pancreas equals continuous glucose monitor plus insulin pump plus control algorithm. The discipline that studies control algorithms is control engineering. How does the artificial pancreas work? The objective of creating an artificial pancreas is to simulate the work that a real pancreas does for the organism. This organ is responsible for creating insulin, which, as we said, is the hormone responsible for distributing and helping to assimilate glucose so that our body gets energy from it. Artificial pancreas simulates the work of a real pancreas. There are currently several prototypes of artificial pancreas that are under development and in the testing phase. Although their operation is quite similar, an infuser, such as an insulin pump, is needed to administer the treatment, a subcutaneous sensor that is responsible for performing the blood sugar measurements, and in the most practical cases for the user, a smartphone that performs the interface functions and is responsible for collecting and managing the data. This system has several advantages over the usual way to control diabetes. As we have a sensor that makes measurements constantly, it is not necessary to make punctures to measure glucose. Thanks to this sensor, and to an algorithm that calculates the necessary dose based on our activity, the necessary amount of insulin is injected autonomously. By making constant measurements, hyper and hypoglycemia would be avoided since we would have a much more thorough control of the blood glucose level. It would allow greater freedom for people with diabetes by not having to take measurements and inject. The sensor, the infuser and the smartphone would be connected at all times via Bluetooth, so at no time would we have cables or other connection systems in our body. Work continues on the best way to charge the device and administer insulin, since there are prototypes that work with subcutaneous patches that would not require an insulin pump to use. Another advantage of this system, which includes mobile technology and network connection, would be related to telemedicine. The data that the sensor is obtaining would be stored in the app or software that manages the system, and these could be sent simply and periodically to our specialist doctor to analyze and study them in a relevant way. Although the goal of curing diabetes is still far away, efforts are focused on making life easier for people living with it. The artificial pancreas would fulfill the function of providing its users with freedom and independence that, to this day, has not yet achieved any other system. A study demonstrates the usefulness of the artificial pancreas. The artificial pancreas improves blood glucose control both day and night. This has been demonstrated by a multi-center randomized clinical trial that evaluates a new artificial pancreas system. This system, which automatically monitors and regulates blood glucose levels, has been shown to be more effective than existing treatments to control blood glucose levels in people with type 1 diabetes. The results of this research have been published in the New England Journal of Medicine and have been funded by the National Institute of Diabetes and Digestive and Kidney Diseases (NIDDK) of the National Health Service of the United Kingdom. The International Diabetes Closed Loop Study (IDCL) has included 5 clinical protocols for artificial pancreas, an all-in-one system that includes a continuous glucose monitor and automatically administers insulin, independently implemented by 10 research centers. This 6-month study has been the third phase of the series of trials. It was done with participants in their daily environment, so that researchers could better understand how the system works in typical daily routines. Testing the safety and efficacy of new technologies in real-world settings is essential to demonstrate the usability of these systems by people with diabetes to achieve better daily control of their blood glucose levels. This IDCL protocol included 168 participants aged 14 years or older with type 1 diabetes. They were randomly assigned to use the artificial pancreas system called Control-IQ or sensor-augmented pump therapy (SAP) with a continuous glucose meter (CGM) and an insulin pump that did not adjust insulin automatically throughout the day. Participants had contact with study staff every 2 to 4 weeks to download and review the device data. There was no remote monitoring of the systems, so the study would reflect real-world use. Glucose target range. Researchers have found that users of the artificial pancreas system significantly increased the amount of time with their blood glucose levels in the target range from 70 to 180 mg per deciliter by an average of 2.6 hours per day since the test began, while the time in the optimal range in the SAP group remained unchanged for 6 months. Users of artificial pancreas also showed improvements in the time they spend in high and low blood glucose, hemoglobin A1C and other measures related to diabetes control compared to the SAP group. The system increased the time in target glucose range. The high adherence to the use of the device in both groups and the retention of 100% of the participants have been some of the important strengths of the study. During the trial time, no severe hypoglycemia events occurred in any of the groups. Diabetic ketoacidosis occurred in a participant in the artificial pancreas group due to a problem with the equipment that supplies insulin from the pump. Control-IQ technology is derived from a system originally developed at the University of Charlottesville, Virginia and the UVA Diabetes Technology Center with the financial support of NIDDK. In this system, the insulin pump is programmed with advanced control algorithms based on a mathematical model that uses the person's glucose monitoring information to automatically adjust the insulin dose. Tandem Diabetes Care has submitted the results to the US FDA to request approval and begin marketing the Control-IQ system. This artificial pancreas system has several unique features that improve glucose control beyond what can be achieved with traditional methods. In particular, there is a special safety module dedicated to the prevention of hypoglycemia, and the control is gradually stepped up at night to reach almost normal blood sugar levels every morning. Artificial pancreas is already used in the treatment of type 1 diabetes. The artificial pancreas is an important challenge for engineers due to the complexity of the problem. However, in the last decade the advances have been impressive and encouraging. This effort has culminated with the approval in September 2016, by the FDA regulatory agency in the United States, of an artificial pancreas for the first time, the Medtronic Minim 670G, giving the green light to its commercialization in that country. A total of 18 systems are currently under development. Very soon the artificial pancreas will be a reality that will undoubtedly contribute to the improvement of the quality of life of patients with type 1 diabetes. Did you like this video? If so, please subscribe to our channel so we can send you notifications about our new released videos. Thank you.